I think the most prevalent symptom is loss of appetite or anorexia. And the second most common is a toss-up between epigastric or upper abdominal pain and diarrhea. And that would happen in about 20% of patients with COVID-19. I think, the COVID-2 virus, which is the causal organism for COVID-19, is a rather fascinating bug. And its effects on the GI tract are many. It certainly changes the way that the GI tract performs its transport function. The GI tract its major job is to transport food and nutrients from north to south and get it to all the areas where it should. COVID certainly disrupts that and makes it such that it's difficult for the body to absorb fluid and electrolytes. And this is often temporary and can resolve on its own, but can lead to other deleterious things. I have seen quite a few patients now with gastrointestinal bleeding in the setting of COVID-19. This makes their care quite difficult from both the treatment standpoint and in the invention prevention standpoint. It also causes liver disease and causes liver chemistries to become abnormal. And when patients have the intersect of abnormal blood tests and typical symptoms, it may lead us down the diagnostic path of chasing after other things which are not COVID related. So when you take a look at all of this, giving both our personal experience here in Rochester and the world's experience, it clearly has a big gastrointestinal footprint. They are because they're medically busy. They're more likely to come in contact or to be in an area where COVID might be in significant numbers. So for example, someone who's in a care home or a nursing home, as we call them, that's the sort of setting where you're likely to get COVID because the prevalence or the amount of COVID in the environment is fairly significantly high. What's more important is not just developing the virus, but these pre-existing conditions then make them more susceptible to the worst manifestations of the virus, so they're the sickest patients. I answer the question with some humility. At the same time, we have some knowledge about what viruses may do to the gastrointestinal tract. In the recent years, we've come to understand that the virus may go, but you're often left with a digestive tract that no longer behaves with a normal rhythm and doesn't have the normal ebb and flow that it had before. This is what we describe as post-infectious dysmotility. It's a bit of a mouthful, but it describes what's happened. The infection is gone, so it's after infection dysmotility, meaning that it no longer moves properly. And this manifests in so many ways as moving too often, or moving too little. Digestive tracts are meant to be quiet, but when they're no longer quiet and when they don't act predictably, it becomes a nuisance for the person who's suffering with this. I think COVID might do the same thing. It's still early days. People are recovering. Most of the experience we have is both here in Rochester and from the big study that was done in China, looking at all of the people with COVID-19 in China who had digestive manifestations. So it's still early days to answer your question in full. One of the biggest concerns, and I'll start with that, is that a number of these patients get treated with agents that suppress their immunity. And that's because patients with ulcerative colitis and patients with Crohn's disease have so much of a heightened immunity against their own intestines. So these are idiopathic autoimmune type problems, if you will. And so we treat many of these patients by bringing down their immunity by using steroids or using what we call monoclonal antibodies to decrease this active immune system. Obviously, increases the potential risk that they could get an infection like COVID-19, and that if it were there, it would allow it to overwhelm the body in more ways than in someone whose immunity was normal. Luckily, we haven't seen much of this, and we think that we shouldn't stop those medications because those patients are more likely to be hurt by stopping the medications than by COVID-19. But we're very wary of this potential problem. So patients who are taking these medicines need to exhibit the most care, and we must exhibit the most care in their direction in terms of infection prevention, hand washing, social distancing, etc., and those sorts of things. For the patient who has these diseases, these conditions, their diarrhea could be significantly worsened if they develop COVID-19. And so you're having one problem on top of a pre-existing problem. And the recipe for that is significant physiologic derangement and all the bad things that can happen as a result of your physiology going awry. So I think for those patients, prevention is worth so much, and we must spend a significant amount of effort trying to prevent them from getting COVID-19. If you unfortunately get the infection, the most important thing to watch for are continued changes and deviations from normal. Your temperature, your breathing, and how much you're functioning. The further away you get from normal functioning, and the more difficulty you have with breathing and the things that you take for granted on a daily basis, the more you need a doctor. And the more that you need to partner with somebody to help you through it. So vigilance, 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 but it all starts at infection prevention. I think you can't know without a test. Actually, this week started for me with a patient who presented with vomiting and dark stools, which are a symptom of blood in your stool. We tested that patient because, for two reasons. One, because of the possibility that these could be COVID symptoms. But secondly, because all patients who are undergoing procedures at Rochester Regional are being tested for the presence of the COVID-2 virus. That's the virus that causes COVID. And he was positive. So a high index of suspicion, but you need the test to be absolutely sure. There are many things that can manifest as COVID. The only way to differentiate it between something else in COVID is a properly done test. And let me emphasize that the test should be properly done. What's happened, and when we look at the Chinese example and some of the data that came out from Italy, is that yes, we can recover parts of the virus or even the whole virus from stool, particularly in the early parts of the illness. What's not been shown, however, is human-to-human spread through that route. So yes, great caution. Yes, we certainly can recover the virus from stool. Whether it can spread in what we call the orophycal way is less clear. Obviously, I think there should be no reason to expose yourself to someone else's infected stool. However, if you do work in and around stool, like digestive disease professionals or laboratory professionals, it's important to practice and use personal protective equipment to prevent contact with the virus.